take a deep breath. You've just completed an essential part of living, and one that people struggle with daily. Breathing. Breathing is an often overlooked task. That is until you struggle to do so. Do you or someone you know struggle to breathe? Let's take a minute and imagine what it's like for those who suffer from any form of lung disease. Lung disease is a complex disorder with many possible diagnoses. Unfortunately, I've had some experience with this through my family. My father was diagnosed with stage 4 lung cancer and passed away just shy of 2 years ago. My oldest son was diagnosed with asthma at the age of 3, and his younger brother is following right in his footsteps. He actually spent time in the hospital over the weekend because of his asthma. Watching one of your loved ones struggle to breathe is scary and heartbreaking. About 3 years ago, my oldest son was tested for cystic fibrosis. Waiting for those results were grueling. In his article, Breathing Lessons, Avery Comroy states, "For a child with cystic fibrosis, every breath is a small victory in a never-ending battle, and there is no cure." Fortunately for us, Jacob was negative. He does not have cystic fibrosis. The American Lung Association helps build a healthier future, saves lives today, and helps keep America healthy tomorrow. By donating your time and your money, you can help the American Lung Association today. Bear with me as I discuss lung function and the importance of the lungs, lung cancer, smoking, and the importance of clean air, as well as the American Lung Association and what they do. We must first understand the role and the importance of the respiratory system to understand the significant impact that lung disease has. So what is the respiratory system? According to the American Lung Association, it's a group of tissues and organs that work together to help you breathe. And the main job is to move fresh air in and to expel waste gases. So why are your lungs so important? They perform a vital process called gas exchange. Once inhaled, lungs move the oxygen through your bloodstream, and then it's carried throughout your body. Each cell then is exchanged for oxygen and carbon dioxide. Then the bloodstream then carries the waste gas to the lungs where it's exhaled. There's 3 areas of the airway that we're going to explore today. The airway of the respiratory system. The airway, the lungs, blood vessels, and muscles and bone. The airway is composed of the sinuses, which are hollow spaces in your bones in your face and head that help regulate temperature and humidity in the air we breathe. Your nose and mouth are entrances for air. The nose is most preferred because of the hairs that act as a cleaning system. Your throat collects the air and passes it down to your windpipe. Your windpipe, or the trachea, is the passage between your throat and your lungs. Your bronchial tubes divide into your right and left lobes, and further down they divide into bronchioles. The lungs and blood vessels contain lobes. The right lung has 3 lobes or sections, and the left lobe has 2. The left lung has 2 lobes or sections that move air in and out. The pleura, the membranes surrounding your lungs, separate the lungs from the chest wall. Cilia are fine hairs that move in waves to move mucus upward. Bronchioles house the small air sacs called alveoli. The capillaries contain the small blood vessels where gas exchange occurs. And the pulmonary artery is where blood enters, and the pulmonary vein is where the blood exits. The muscles and bones. The diaphragm is the strong wall of muscles that separates the chest cavity from the abdominal cavity, and it creates a suction, drawing in air and expanding your lungs. The ribs are the bones that support and protect your chest cavity. According to the American Lung Association, you should keep your lungs healthy by eating a balanced diet, exercising, and decreasing your stress. Chronic cough, shortness of breath, chronic mucus production, wheezing, coughing up blood, and chronic pain are warning signs according to the American Lung Association for lung disease. The American Lung Association focuses on defeating cancer, improving the air we breathe, decreasing the burden of lung disease, eliminating tobacco use, and accelerating fundraising. As demonstrated by Bailey and Sprague, in 1964, the U.S. Surgeon General Luther Terry proclaimed smoking was linked to lung cancer. In 1994, the Commissioner for the Food and Drug Administration, the FDA, declared nicotine an addictive substance. Exposure to secondhand smoke greatly increases the risk of ear infections, respiratory infections, and sudden infant death syndrome, or SIDS, in infants and children. The American Lung Association is committed to ending death and disease related from tobacco use. In a study conducted by Wood, Kelly, Molinex, and Bunn, an estimated 90% of lung cancer is attributed to either passive or active smoking. Lung cancer is the most common cause of cancer-related deaths in both men and women. According to the American Lung Association, they are committed to funding $10 million specifically for lung cancer research with a focus on projects to find cures, prevent and relieve suffering. According to Springer Climate, air pollution is considered the world's worst environmental risk, as well as many air pollutants are harmful to human health and ecosystems. The American Lung Association states air pollution poses a serious threat to our nation's health by harming our lung tissue and increasing our risk of lung disease. The American Lung Association goes on to further add that more than 32 million Americans live with chronic lung disease, such as asthma or chronic obstructive pulmonary disorder, or COPD. The American Lung Association is continually working to reduce the burden of lung disease through education and support programs for those who suffer from lung disease, their caregivers, and their loved ones. The American Lung Association has a national helpline, 1-800-LUNG-USA, or you can visit www.lung.org. This hotline is staffed by registered nurses, physical therapists, certified tobacco specialists, and counselors who are ready to help you at any time with any of your lung care or lung health needs. For more than 110 years, the American Lung Association has led the fight for healthy lungs and healthy air. Whether it's searching for cures for diseases or keeping kids off tobacco, or fighting for laws that protect our air we breathe, the work of the American Lung Association helps save lives every day. For 100 years, the American Lung Association has supported research to help Americans live longer, healthier lives, and they continue to fund, develop, promote, and advocate for programs that will result in life-changing advances for people impacted by lung disease. Ohio currently has 3 researchers who hold a PhD who are researching asthma and allergy, as well as tuberculosis. As we already know, tobacco disease-related deaths are high, and so the American Lung Association is diligently working to eliminate tobacco use and tobacco-related disease. The American Lung Association Freedom from Smoking program has helped over 1 million Americans in their quest to live smoke-free lives. They will also continue to work on strengthening laws and policies to protect everyone from secondhand smoke and the deadly effects of tobacco use. The American Lung Association works to protect public health from unhealthy air pollution by supporting the Clean Air Act and the United States Environmental Protection Agency's authority to ensure that all Americans have the air that is safe and healthy to breathe. They also complete an annual State of the Air report, which analyzes data from official air quality monitors to compare and understand the air quality and what we can do to improve it. Saved by the Scan is a low-dose CT scan that is available to smokers or former smokers and is a test that is used to detect early stages of lung cancer when it's easily treatable. It is covered by health insurances for patients who meet the high-risk criteria and are between the ages of 55 and 80 for those who carry private insurance, or between the ages of 55 and 77 for those who carry Medicare. The American Lung Association is leading the way to help you breathe easier, and they need your help. Your monetary contribution supports research, program development, public policy, sharing up-to-date information on respiratory diseases, their treatment and management. If you're unable to donate your money, please donate your time by becoming a volunteer or advocate. I challenge you to explore the American Lung Association and what they can do for you, a loved one, or even a stranger. I challenge you to stand up, speak out, and act. Make a difference in the world, be an impact on those around you. Please take it upon yourself to help in any way you can. If you can't donate money, please donate your time. Both are invaluable. Please visit www.lung.org today. People are counting on you, maybe even someone you love.